Hi, my name is Kale Evans. I'm a student nurse at Wilson State College, and today in my skills video I will be performing passive range of motion, repositioning a patient in bed, taking a patient to ambulate, as well as putting on pressure stockings. So before going into the patient's room, I would check for any repositional restrictions, and then after checking the patient's chart, I would then enter the room by knocking. And as I enter, I would perform hand hygiene and then closing the door for patient privacy. So I would go and explain to the patient what we would be doing today, as well as confirming with the patient who they are by asking for name and date of birth. And after getting that, I would raise the bed to a working height, and I would explain to them that we will be performing passive range of motion, as well as repositioning them and taking them for a walk. So within the passive range of motion, I will only expose what is needed. And to start off, I'll be doing the hand and arm. So to begin, I will rotate the shoulder straight up 180 degrees, or until there is resistance met, or until patient can withstand it. And for the purpose of this video, I'll be only doing it 2 times, but in a clinical setting I would do it 5 to 10 times, as well as on both sides. So there's 1 and 2, and then the next one would be to rotate it out into the abduction 12 times. And then the last one for the arm would be from down from the hip up to the shoulder. This mannequin doesn't do that motion as well. So we do once and then twice, and that is all for the arm. And then we move on to the leg, and only exposing what is needed, and with supporting underneath the knee and the ankle, I would go up to a 90 degree once and twice, and then with the adduction out and the abduction in, which would go across the midline of the body, and we would do that twice. And then for the last of the leg exercises, we would go on the external rotation, making sure that the whole leg rotates 2 times, and then internally rotate 2 times. And that would be the end of all of the range of motions. And I've noticed that the patient is a little low in bed, so I'm going to ask for assistance in boosting the patient up into a higher position. And this patient's able to assist us, so they would have their legs bent in so that they could boost themselves up using their legs. And so with the head rails down, I would also move the patient's pillow to the top of the bed, so that if we move them too far, they don't hit their head. And with rolling the draw sheet up in on itself, we would then boost them up into bed on the count of 3. So 1, 2, 3, and we would then put the patient's pillow back into a safe, comfortable position. And next, I will then rotate the patient into a lateral position. And in doing so, I will pull the patient towards me on the count of 3. 1, 2, 3. And then we will rotate the patient towards my colleague. And I will position pillows underneath the back from the shoulders to the hips, as well as one in between the legs. In the clinical setting, I would keep them covered for modesty, but in this video, they will be partly exposed so that the instructors are able to see what I am doing. And then we will then roll them back, and I will slightly rotate their bottom shoulder out so that it is comfortable as well. And then once we've completed this, now we're going to bring them back over to my colleague so that we can place them into the supine position. So I will remove the pillows. And roll the patient back. In the supine position, we will position pillows underneath both arms, but for the purpose of this video, it will just be one arm, as well as underneath behind the knees of the patient, but also making sure that it will not cut off any circulation. And also you can position a pillow underneath the ankles to prevent pressure sores from starting on the back of the heels. Normally it would be further up so that the heels can dangle and not have any pressure on them. And once I have the patient into this position, I would then take my first blood pressure reading for orthostatic hypotension. And the next thing that I will do is I will bring the patient up into a semi-Fowler's position. And once we have the patient in a semi-Fowler's position, I will then, because we're getting ready to ambulate, I'm going to switch from the mannequin to a real person. So I'll remove the pillows and move the mannequin to one side. Side row out for my helper. And then to get ready to ambulate and move, I will put a gait belt onto my patient here, and it would go just underneath just above the umbilicus, excuse me, and have it just tight enough to where I can fit 3 fingers underneath, and I can also tuck this away so that it's not in the way. And then I will instruct the patient that I'll be helping them up and just to swing their legs so that they can dangle. So on the count of 3, we're gonna come up. Ready? 1, 2, 3, and rotate. And now that the patient is dangling, I would let them dangle from 1 to 3 minutes and then take another blood pressure reading for orthostatic hypotension. For the purpose of this video, I'll let them dangle for 30 seconds while I prepare the wheelchair, checking back with them to making sure that they're not nauseous, dizzy, or if they have any pain. So do you have any nausea, dizziness, or any pain?
No.
Okay. So once I've confirmed with them that they're not feeling bad in any way, then I will drop the bed down so that their feet can touch the ground so that we can begin the transfer. So now that their feet are on the ground, I will position my feet, align with theirs as well as my knees, and I'll bend at the waist and grab. I will instruct the patient that they can grab my arms, and on the count of 3, we will come and stand up nice and tall. 1, 2, 3. And then we will turn, and then when you feel the chair on the back of your legs, you can reach back for the arms and sit. Perfect. And so once the patient's sitting down, I will then ask them again if they're still feeling good or if they have any nausea, dizziness, or any pain. So are you still feeling well, or do you have any nausea, dizziness, or pain?
No, I'm good.
Okay, so now we will then begin ambulating. So again, I will position my feet, align with theirs as well as my knees, and I will squat and grab underneath the gait belt and instruct them to grab my arm. And on the count of 3, we'll stand nice and tall. Ready? 1, 2, 3. Perfect. And then I will just shuffle my way behind them, grabbing behind both of their sides, and then we will then walk towards the table. And then we will go back, and we're gonna sit back into bed. Perfect. And we will have you turn, and there we are. And then I will reposition the bed into a working height so that I can put on the pressure stocking, excuse me. So I'll gather my supplies, and I've made sure to assess the foot so that there's no open lesions to where I would need to wear gloves. And in measuring to get the correct size sock, you would measure 1 inch below the knee, and then go all the way down to the bottom of the heel. So that's roughly 18 inches. And then I would also measure the widest part of the calf, just right there. So 18 by 15. So with those measurements, I would be able to know what the correct size pressure stocking would be. And then I would find the heel of the stocking, which is right there, and begin rolling it up. And then I will slip it over the patient's foot. And piece by piece, I will bring it over the heel. And then I will pull it all the way up, making sure to get all wrinkles out all the way around. And then once it gets to the top, I will then fold it back over. Obviously, this isn't the correct size stocking, but in clinical setting, I would make sure that I would have the correct size stocking for the patient. And I would know that it's in the correct spot because the opening would be on the bottom so that we can easily open up to check for proper circulation. And then once I've completed this, I would check with the patient to make sure that they're comfortable and they don't need anything else. I would also perform hand hygiene on my way out. I would tidy the room, and I would also lower the bed into the lowest position so if the patient finds any need to get up, it's not a fall hazard. And that concludes my skills video.